welcome back to Ageless Living here on World Talk Radio on Voice America. This is Kurt Wilhelm, the co-host of the show, and joined by Dr. Lee, Dr. Tong Lee, who is the knowledgeable one amongst us. And there's several reasons that she is so knowledgeable. Dr. Lee has Eastern medicinal degrees and also Western medicinal degrees and practices both types of medicine. So if any of you are looking to have a truly integrative experience, I would definitely recommend that you get in contact with Dr. Lee through one of our sponsors, Arizona Laser and Skin. So Arizona Laser and Skin is actually three things bundled in one. It's a holistic practice. It also is a med spa and also a cosmetic surgery. So if you are looking for a very holistic approach to your life, whether that's because you're trying to become more beautiful or because you're trying to become more balanced or just overall more healthy, I'd recommend going to azmdlaser.com, visit the website, and also if they wanted to schedule an appointment, Dr. Lee, what's the proper phone number?
The phone number is 480-598-9733. Again, it's 480-598-9733. And we're located at I-10 and Chandler Boulevard, just on 46th Street, block south of Chandler Boulevard.
You bet. So just right there off the I-10 and Ray Road, just very, very easy to get to. And here's the reason that I bring this up, is that when you're inside of an integrative medicinal practice, you're not just told, here, take some aspirin, thin your blood, get that blood pressure down, and relax a little bit. There's other types of things that can actually help hypertension, high blood pressure, such as acupuncture. And Dr. Lee actually does practice acupuncture. Dr. Lee, do you want to tell us a little bit about how acupuncture helps reduce blood pressure?
Well, you know, how it helps with the blood pressure is not clearly known, but we know it does.
Sure.
It's just like meditation, yoga, and you know, there are a lot of proposed theories how it works, but you know what, it works.
And there's quantitative studies that actually show that.
Absolutely. And what the key thing is you do want to maintain your blood pressure at a normal level, and we're going to go over that a little bit more, because that's the ultimate goal. Because if you can control your blood pressure, then you can lead a relatively normal life with this silent disease. So, you know, there are a lot of reasons behind it, why we're going to talk about if hypertension is something that can be cured, because this is debatable, and we're going to debate about it.
I'm going to make, I don't know why this just came into my head. It's not so much an analogy, it's just a funny little experience that I had. Obviously, all of us love to save water inside of our homes. The lower the less water we use, the better it is for the environment, and in particular, the easier it is on the pocketbook. But in particular, the reason why this came to my attention is that there was too much pressure in our home in the water pipes. And one day the shower head just shot off. So that's kind of what it had.
No one got hurt. Right?
And nobody got hurt, thank goodness. But the point is that the reason why it was this came to my mind is that that's essentially what we're doing to our bodies when we have too much pressure in our veins. It's
there are similarities, but there are differences too.
Okay, go ahead.
Yeah, and the difference is somewhat mechanical, except in the human bodies, brain controls everything.
Mm-hmm.
There is chemical signal carrying messengers from the endocrine system. There is the brain, the nervous system. I mean, it's so much more delicate and complex than the mechanical pipe, but it does have some similarity. You got a pump, you got the pipe, there's pressure.
Sure.
There's some of that too.
Mm-hmm.
So we were going to talk about the muscles. Did you know that there are muscles in your blood pressure, in your blood vessels?
I didn't know.
They're called smooth muscle. They're not the skeletal muscle. It's different.
Okay.
They're tiny little blood vessels in the, especially arteries. Not as much in the veins, but that will allow the body to constrict and relax blood vessels.
Cool.
It is really cool. Does your pipe do that at home?
Nope. That's why the shower head shot off.
That's right. I mean, there's accommodation, there's limits, and this is when when the blood vessel wall is too rigid, not flexible enough as we get older, or if the pressure is too much, or if the wall has a weakness. That's where we have strokes, we have other problems. So, but basically, there are small, tiny blood muscles in the blood pressure in the blood vessel walls. Those muscles are controlled by like I said, the chemical messengers, the central nervous system, and also the sympathetic nerve system. And so this is why a lot of things affect our blood pressures. And blood pressure is not a constant. It's like, oh, this is your blood pressure, like your height and weight. It's a fixed number. Blood pressure continuously fluctuates based on what you're doing. So you may have blood pressure that's really, really, really high when you're angry, when you're having an argument or a fight.
So when they talk about that his blood pressure went up and his face got all red, that's exactly what's happening.
That's right. That's
He's
right.
angry, yeah.
Yeah, but when you're asleep, it may be just perfectly normal. This is partially why medications can be very important, because we want it always low so you don't have a chronic problem. But it may not be the best solution.
Got it. If
And
you're
let alone the
artificially
side
keeping
effect.
it low.
Yes, let alone the side effects of it.
Gotcha.
So we talked about the essential high blood pressure. That's pretty much what we're focusing on. That's the 90% of the cases of high blood pressure. The secondary ones are really rare. They're the ones that's more considered curable. The primary or essential high blood pressure, usually you go to the doctor's office, you ask them, oh, I have high blood pressure. Well, by the way, how is high blood pressure diagnosed? Usually it's at the resting situation, not excited, not angry, not after running or walking. You're in a quiet, relaxed situation. It was checked 3 times, being high, being over the limit we talked about, over 140, or to be more stringent, 130 or 20.
I guess it's a little bit harder to get your arm in that little thing while you're on the treadmill, so they can pump it up.
Actually there
are there
finger
other ways?
ones.
Oh,
there are,
hey.
There are all kinds. If you're curious.
Yeah, I would be
you
curious to
can
know what
find
blood
out.
pressure is. A couple of times I felt like my heart was going
See
to
your
pop,
little
but then
mind
guess my
going.
lungs. That's right.
So it's funny that, at this point I thought of something. Wouldn't you say, well, if blood pressure high is bad for you, why would you exercise?
Yes. Now, I could try to answer that question.
Yes.
In my mind, there's at least one aspect, and I know the body's very complex, but the smaller your arteries are, the higher the pressure is. If you really think about it, if your body is pushing, your heart is pushing the blood through the veins, and it has a smaller hole, then just the physics of it, you're going to increase the pressure. Now, when you exercise, it actually helps clear out your arteries, and so just by the mechanical nature of it, your blood pressure is going to go down, but I know there's a much more complex answer.
That was a good point.
Okay.
You're talking about the cholesterols,
Yeah.
or the plugs of the buildup inside the blood vessels. Yeah, that's very good. Exercise does reduce your cholesterol level, which hopefully will indirectly help gradually reduce your buildup in the blood vessels.
By widening the pathway in those
Right.
arteries, but I know there's much more to
Absolutely. But just don't think it too hard, to so much details.
it. Can you tell I have engineering background?
Absolutely. All the pipes and
Yeah.
But if you're, like we talked about, I think in one of our previous show, we talked about the heart rate in the same way. If exercise is going to raise your heart rate, and a slower heart rate is good for you, and why are we exercising? Well, the body is so complex. You know, when you actually exercise to raise the blood pressure and heart rate, it will reduce your normal resting rate.
Okay.
So it's like you're modulating it, you're modifying it by stretching it, so you are more flexible.
Okay.
So the blood vessel walls do become stiff when we age.
Oh.
Exercising reduces that speed of aging, of stiffening.
Uh-huh.
It makes you more flexible.
Oh.
So your blood vessel walls are more flexible, so you can have better blood pressure.
So in a way, you are also, be it by the opening and closing of the, or by the expansion and contraction of those
Absolutely.
veins, you're exercising those smooth muscles in there.
Right.
Okay. There you go. So
So-
I'm learning.
Yes, it's really fun.
Uh-huh.
Even though the smooth muscle
Mhm.
in the blood vessel wall is not something like skeletal muscle you can tell it, oh, move, bend. Even though it doesn't work that way, the brain does have power over it.
Mhm.
When you're stressed, your little blood vessels will constrict.
I see.
And if you relax your mind, if you become not stressed, the vessels will relax. That's why meditation and relaxation or reduce stress can help. Some of these are not exactly proven, but there are more of theories.
Mhm.
This is why we call it essential hypertension or unknown cause hypertension, but these are the theories,
I got
and
you.
which make a lot of sense.
Mhm.
So primary and secondary hypertension, we talked about the vessels can be controlled and how it works. And even though, I just want to add a little bit more on the secondary hypertension. Even though we know these diseases, tumors, and the artery defect, like narrowing, can cause those secondary hypertension. Some people also consider those lifestyle factors to be the causes, or highly associated factors that contribute to hypertension. And those factors include obesity. Not a
Mhm.
surprise, we kind of know that.
Yeah,
Yeah.
that is true.
Why is that? Imagine you have more tissue to supply oxygen and blood to.
Mhm.
Your heart has to pump harder, a lot harder, to go through a lot longer vasculature to get there.
Somebody somebody said that there's so many capillaries in our fat tissue that that if you lined them up end on end, now I want you to correct me, or if you lined them up end on end, if you're 50 pounds overweight, that's almost a mile of extra pumping that your heart has to
I'm
do.
not surprised. I don't know exact, but I'm not surprised about it. And when I was taking one of those anesthesia board exam, I saw one question that really impressed me too. That is, the heart has to pump something like 5 to 10 times harder if you double your weight.
Really? Yeah, so less wear and tear. Now, okay, so here's another contradiction. If most things wear out when in use, then why does exercise make your heart more healthy, and why does making it work 10 times harder when you're twice the weight not healthy for it?
This is because that is constantly you carrying the weight. The
Mhm.
supply is constant, but exercise is not constant.
It's an investment of time rather
That's right.
than, okay,
That's
I
right.
got you.
So obesity being one contributing factor. Sleep apnea
Mhm.
actually can do that too. It's actually interesting. Sleep apnea is not necessarily 100% times associated with obesity, but a lot of times they are. Also the lack of oxygen, and that's called hypoxemia, can be a factor. Drugs, we touched on cocaine. Other medications prescription or over-the-counter medicine can do that. Herbal supplements, some of the herbal supplements can increase your blood pressure. One of the interesting one is licorice. This was interesting.
I've actually heard that. It's supposed to also speed your metabolism, so is chili, right? So which is there a good and a bad way to speed your metabolism without increasing your hypertension?
I guess that depends on your baseline blood pressure. Is it too high with the consumption of licorice, or you know, and also how much you take.
Okay.
So everything in moderation.
Yeah, true.
Excessive licorice consumption can cause raising in blood pressure too. This one I thought it was interesting.
Now this is black licorice, correct?
I think any licorice.
Okay.
I've known a few different kinds.
Okay.
So the definition in the medical dictionary of hypertension is the increase of blood pressure to such a level it will likely to induce cardiovascular damage or other consequences. That is when we call you have a problem, hypertension. And why is hypertension a risk for our health? We talked about high blood pressure is a whole body disease, especially to the organs that's rich in blood vessels. So, you know, in the brain, it can cause either weakening of the blood vessel, which is called aneurysm, but potentially at some point it can not take the pressure and burst. That's not good, like your pipe, you know, like your shower head.
Right, just like
it would
that.
blow off. And that would be a major stroke. That would be bad. In the heart, it can make the heart muscles get really, really fat and thick because the heart has to pump real hard against those high pressure. So that's called cardiomyopathy or hypertrophy, meaning the heart muscles getting thicker and bigger, and eventually it can lead to heart failure.
Oh, wow.
Yeah. And when you have a thicker and bigger, or you can call it fat. It's not really fat, but it's more tissue, more muscle, or fibrous tissue. You need more oxygen. So you actually have a relative shortage of oxygen, which can cause lack of oxygen, which is leading to heart attack.
Can your heart get fat around it, like the liver and kidneys?
You actually can.
Okay.
There's fat everywhere.
I guess so. He's got to store it somewhere.
Well, fat's good in a small quantity. Same thing, moderation. You need fat cushion to protect.
Okay.
Imagine without fat, you know, there's no cushioning, no protection. You know, your heart be hanging there with nothing to cushion it.
Right.
So there's always fibrous tissue, fat, to come to help. I guess, shall we just go on with this one? Because we missed the break.
Oh, did we just completely blow past our break?
I think we did.
Oh, okay. Well, let's take a quick break, and when we come back, we'll pick back up with hypertension and cover. I think is it some of the causes? Or yes.
Everything about high blood pressure.
Okay, sounds good. So when we come back from the break, we'll discuss more about it. If you have hypertension, know somebody who does have hypertension, or you don't want to get hypertension, high blood pressure, then keep your pen and paper handy, and we'll be right back after the break.